Hi, my name's Robyn Ward. I'm the Acting Executive Dean of the Faculty of Medicine at the University of Queensland, and I'm here today with Dr. Shane Kelly, who is the CEO of MARTA Health Services. Welcome, Shane.
Thank you very much, Robyn.
Could you start by just telling us a little bit about MARTA? What's involved in that?
Well, the MARTA's been around for over 100 years. It has its origins in the Congregation of the Sisters of Mercy, and in fact this building that we're in was one of their earliest hospitals here in Brisbane, which essentially has been operated right through the 20th century, from early in the 1900s until now. And we provide a range of hospital and healthcare services, both private and publicly funded. And we've got a large campus here on the Brisbane site. We're about South Brisbane site. We're about 1,000 beds all up, and we've got smaller hospitals out in Redlands and in Springfield. So we have been a long time provider of hospital and healthcare services to people in Queensland, and had a long association with the University of Queensland as well.
Great. And I know that you're a doctor yourself,
Yeah.
So can you tell me the differences in your mind between when you trained as a medical student and what it's like for medical students training in your hospitals today?
Oh, they've got it so much easier these days. Look, I think, I actually do think they've got great opportunities these days to use a whole range of services and IT in particular to help their learning. So I think about the fact that when you and I were training in medicine, that there was a lot of didactic tutorials, lectures, lots of reliance on textbooks that were two-dimensional and black and white, and the opportunities today for them are very different. And also I think we've gotten better at providing access to clinical areas and to patients to be able to learn on the job, if you like, as part of their combination of their university experience and their clinical experience to make them good doctors going forward.
So how do you see as a CEO that medical students really contribute to the life of the hospital?
Yeah.
What would your hospital be like if you didn't have medical students?
Yeah, I think it's certainly in the medical fraternity or in healthcare generally, it's a well believed and recognised that the presence of students, and particularly medical students, sharpens the focus of your staff, and that they can actually, by their very presence and their very questioning of the treatment that's being offered to patients, provide for better patient care and better patient outcomes. So I think that's one key point. So it's better for the patients. Patients actually, by and large, love to provide them their story and their experience with, and share that with medical students and help train medical students. So that's terrific as well. But it also means that we've got our own staff who have a role in teaching, and that to a lot of people is very rewarding to be able to teach people like medical students in our hospitals. So I think they are a great addition to the fabric of care in a hospital and health service like ours.
And do you see medical students coming through the University of Queensland as your future employees?
And that was going to be my next point. On top of the fact that we think they make a difference by being here, they are our future doctors, and so it's critical that we have a good relationship with them, see that what we're trying to do, what our mission and vision and values are, and how we're trying to provide great healthcare for Queenslanders, and so that they're in the back of their mind, they're thinking, well, this is a place I'd like to come back to once I've specialised, or as part of my specialisation training, I'd love to come back to the MARTA and contribute in that way. So yes, they're as much a customer in that respect as they are young people learning on the job. So we've got a responsibility to train for the future, generally speaking, but also we have a vested interest in that.
Yeah. And you just mentioned the future there, so I just wondered if you wanted to pan forward a decade and think, what would we have to be doing as a medical student educator to train medical professionals that are going to be fit for purpose 10 years from now?
Yeah, I've got to say I'm not good at predicting 10 years ahead, because that in health terms and in society, I think generally these days that's a long time, and a lot can happen certainly the sort of trends that I see happening in healthcare, very much an increase in consumer focus, which we're a laggard as an industry in that respect, but we're trying to get on the front foot in that respect. But also the technology, the drugs and the microtechnology and the macrotechnology that's evolving and going to be available to those current medical students when they're doctors of the future is very exciting, and I think they're living through a period that provides for a really fascinating and exciting and rapidly changing experience, if you like, for them to deliver healthcare. You don't have to go back too many years, and the doctor didn't have a lot in their armamentarium to make a great difference to health outcomes. Much more now, and I think incredibly advanced if you look forward another 10 or 15 years.
Yeah, everything on an iPhone or...
Everything on an iPhone, but the precision medicine, the genomics, all the omics that you talk about at university level, they're really going to change the way in which patients are treated, the way in which healthcare is delivered, probably the places healthcare is delivered as well. So it looks to me to be quite a different environment in 10 or 15 years' time, but a very exciting one for our young doctors as medical students.
And is there anything you think a university should be doing to sort of speed up the rate at which we're training students so that they're better able to work in this modern environment in a hospital, which is, as you say, changing so rapidly?
Yeah, look, it's incredibly hard. I think it was even hard when you and I were medical students to cram all that learning into 6 years. Now there's so much more knowledge, and they're having to cram it into 4 postgraduate years or thereabouts. So really now the focus has to be about them being lifetime learners and giving them the skills to be lifetime learners, and giving them direction as to how they can make sure that that's their paradigm, rather than having an expectation that in the time that they're a medical student they're going to learn mostly everything they need to know to deliver healthcare.
And I think that's one of the advantages that we talk about at UQ, is this ability to ensure that our students are lifelong learners.
Yeah.
And part of the formula around that is research. That if we've embedded them in a research culture, they'll always be questioning what they're being asked to do.
Yeah.
How important is research in your mind to the way a hospital functions every day?
Yeah. For us, it's a centrepiece of our strategy. We have a research institute, so we have a strong focus on medical research here already. But the key part of our current strategy is the greater integration of our healthcare delivery with our research and with our education arms of our organisation, because as you well know, there's a lot that's done in healthcare delivery that doesn't have a robust evidence base behind it, and what we're about is about improving that evidence base and changing models of care and changing healthcare delivery to reflect what contemporary knowledge has been gained as a consequence of the research that not only we're conducting, but that lots of other people in lots of other organisations across the world are doing.
And so that dialogue between the university and our healthcare system is ever more important.
It's tighter and tighter.
Yeah.
And I genuinely believe that's the future, because we have to practice evidence-based medicine. We have to recognise that we need to shorten the period between knowledge gained and practice change. And it's been too long in our time, and we just need to crunch that time together.
Yeah, great. Well, it's been great talking to you today. It's really been interesting to hear your perspectives around both education and research. So thank you very much, and keep up the good work.
No, it's my pleasure. Thank you.